Again, I wanted to extend a warm welcome to everyone joining us today and welcome to today's webinar. Next slide, please. Next slide, please. So again, welcome to our webinar today on family inclusion. This is the third in our family inclusion webinar series. This is session 3 on implementing family inclusion standards. This webinar is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center, or MHTTC, and we're housed at Rutgers, so in the School of Health Professions, in the Department of Psychiatric Rehabilitation and Counseling Professions. My name is Kathy, and I'll be facilitating this webinar today. Next slide, please. The MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of the behavioral health and other related workforces to deliver evidence-based and empirically supported practices to individuals with mental illnesses. Please visit the MHTTC Network website for additional information at mhttcnetwork.org. Next slide, please. And if you're interested in staying up to date with the events and products that the Northeast and Caribbean MHTTC is providing, we ask that you sign up to receive our email communications. You can sign up at the bit.ly link provided on the screen, and I will also share this link in the chat box. Next slide, please. Following the presentation, you will be asked to complete a brief survey. We value this feedback and use it to improve our activities and inform future activities. The surveys are also important because of our continued funding is linked to the completion of these surveys. So we thank you in advance for your feedback. Next slide, please. We also want to let you know that this webinar is being recorded and will be posted to our website along with the PowerPoint presentation in the next few days. Next slide. This presentation was prepared for the Northeast and Caribbean Mental Health Technology Transfer Center under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Citation of the source is appreciated. Please do not reproduce or distribute this presentation for a fee without specific written authorization from the Northeast and Caribbean Mental Health Technology Transfer Center. At the time of this presentation, Tom Codier served as Acting Assistant Secretary for Mental Health and Substance Use at SAMHSA. The opinions expressed herein are the views of the speakers and do not reflect the official position of the Department of Health and Human Services, or SAMHSA. No official support or endorsement of DHHS, SAMHSA, for the opinions described in this presentation is intended or should be inferred. Next slide, please. We encourage you to interact with our presenters during the webinar by using the chat feature. Please post any comments or questions you have in the chat, and I will collect your questions as we go and ask them of the presenter during the Q&A time toward the end of the presentation. During the webinar, our presenter may pose questions to you. Please use the chat feature to answer those questions. The MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. This includes language that is strength-based and hopeful, language that is inclusive and accepting of diverse cultures, genders, perspectives, and experiences, language that is healing-centered and trauma-responsive, language that invites individuals to participate in their own recovery journey, language that is person-first and free of labels, language that is non-judgmental and avoids assumptions, language that is respectful, clear, and understandable and consistent with our actions, policies, and products. Now let's begin our webinar. We have Dr. Michelle Zechner and Ms. Valerie Ferry with us today. Dr. Zechner is an assistant professor at Rutgers in the Department of Psychiatric Rehabilitation and Counseling Programs and has focused her career on the promotion of health and wellness for people with mental health conditions, their families, and the staff who support them for over 25 years. She has worked in a variety of settings, including academia, outpatient mental health programs, family advocacy organization, psychiatric hospitals, nursing homes, and training services. She conducts research, teaches, and mentors students and consults with state psychiatric hospitals on the implementation of evidence-based mental health practices. She is also involved in family advocacy in New Jersey. Ms. Valerie Ferry is the Director of Workforce Development, Family Training, and Advocacy Center, and has worked in outpatient, inpatient, and administrative roles within Philadelphia behavioral health system for 20 years. She oversees various programs at FTAC that champion the importance of family within behavioral health care and works collaboratively with local universities, behavioral health organizations, and family members to educate the workforce and support providers in their efforts to become more family inclusive. We want to welcome everyone, and I'll turn it over to our presenters.
Welcome, everyone. We're so delighted to have you with us today in this final session of Working with Families. And today we're so fortunate to have Valerie talk about the standards of family inclusion that were developed in Philadelphia, which are just a model for the whole country. So we're so fortunate. We'll be talking about those today. And we're also going to be talking briefly about the implementation or some ideas about how to implement the standards. So I'm going to turn it over to Valerie now.
Thanks, Katya, and thanks, Dr. Zechner. So hi, everyone. It's good to see you all here today. I'm here to talk to you about the family inclusion standards for adults. This is a set of standards that came about because in Philadelphia, we were having some concerns about how families may or may not be included in treatment and services. And because I work with a great crew of family members who are also advocates, they have done a lot of research and a lot of work around the ideas that you're going to see in the family standards, many of which we talked about in our previous series, 1 and 2. So basically, the family inclusion standards exist in Philadelphia because there was a need for them. And we feel very lucky to have the support of the Department of Behavioral Health. So what I'm talking about today is something that's being implemented in the city of Philadelphia, but you may find that some of these ideas or things that I'm going to talk about today are applicable to yourself or your own provider system, or just even within your own provider agency. So I'm hoping that what we're doing in Philadelphia can serve as a sort of an incubator of thought for what we could be doing across the country. So I'm certainly interested to hear any of your thoughts or questions during the presentation, but really excited to talk to you about what we've been working on in Philadelphia. So the first thing I wanted to talk about was the fact that family inclusion is not a sort of a given for everyone in every provider system. And what we found in our work is that there are a few barriers to family inclusion and maybe why it's not happening as readily as it should be. The first one is training and education. So for many of you, I'm sure that you've gone to school or you've gotten certificates or you've done work around behavioral health and how to work with an individual. But I find from my experience and what we have found is that it's less likely that people have gotten training or education on how to work with families. Even though we are working with families constantly, it's generally not something that you're getting through training or within your agency as part of training. So for instance, I'm a social worker by trade. I've never taken a course on how to work with families. I was fortunate enough to work with Dr. Zechner last summer. Rutgers offers a whole course on families, which to me was amazing because I had never seen anything like that. I work with 125 graduate students every year who are specializing in counseling and social work. And my program exists because things like family inclusion are not taught generally in those professions, professional education tracks. So that's one of the primary barriers that we find happen with family inclusion is that people are just generally not exposed to it and not taught how to do it. The second barrier we tend to encounter is the environment that which people are working in. Provider agencies are frequently not equipped to know how to work with family members. They don't have programming that is designed for family members. And again, it's not something that's generally at the top of their mind of what they could be doing. So we generally find that folks are working in environments that are not supporting or asking people to be family inclusive in the work that they're doing. We also understand that working with families can be challenging sometimes. And, you may have worked with amazing families. I certainly, in my mind, can think of several families who I've engaged with over the course of my career that I've really enjoyed working with. But I've also worked with some challenging families. And I know that there can be some emotional challenges that can come along with working with family members if you're not feeling prepared to do it in the proper way. So we understand that people's emotions can sometimes be a barrier to interacting with family. And then, of course, personal experience. We all have families of our own. Our families have their own challenges. We all come to this work with our own biases. So be it good or be it bad, our personal experience affects how we work with family members. So we certainly understand that personal experience can sometimes be a barrier to family inclusion if we're not really sure how to deal with that personal experience in the work. Next slide, please. So we very much see the standards as a beneficial thing. We understand that we're asking providers to do some extra work, but we really do believe that this is a key to some beneficial outcomes for a few folks who are involved in it. So the first benefit that we see is the benefit of families and family wellness. So as we've talked about previously and in the series, there are a few things that we could be doing for family members that can improve their overall wellness and the wellness of the family. So some of those things is providing family members with information, what's going on with their loved one. What are some of the things that they need to be thinking about in terms of navigating or managing? What can they expect for their loved one? So just general information is very helpful for family members. Support is also very helpful for family members. How can we lead that family member to a NAMI support group? How can we lead them to other families? How can we be supportive in how they're supporting their loved one through the process? And then also resources. What are some of the things out there that family members need in order to be able to give their loved ones support? We frequently find that family members need everything from support groups to information on how to pay for their electric bill or to make sure that they are able to get basic resources in their household. So that can look very different depending on the family member that you're working on. But these are all some of the areas that the standards cover in terms of what we could be for providing families. Next slide, please. We also believe that there's benefits for participants. We want to make sure that it's not just something that's beneficial for family members, but it's also beneficial for individuals that we serve. We know that when family members are involved with what's going on with individuals, their outcomes are better. Whenever we're able to make sure that they have somebody who's a natural support on their team sort of rooting for them, the outcome is better. So we very much believe that something like the standards can provide benefits for individuals who are in treatment and services through things like support, just general things like we've talked about before, getting people, a ride to services or helping them with medication management. Maybe it's in terms of problem solving. Sometimes it's good to have somebody in your corner who you can talk things out with as you're going through the treatment process. And of course, encouragement and somebody on your team who wants to be there for you. And we believe that natural supports are there to do these things for individuals most of the time. So we just want to make sure that we're getting family members involved, and that we believe that the standards help improve those situations for individuals. Next slide, please. There's also benefits to providers. In Philadelphia, we have something called the practice guidelines. These are things that providers should be doing in terms of best practices, things that we think that should be happening. The family inclusion standards are part of that practice guidelines in Philadelphia, but maybe where you are, you have something similar where there's a standard of care that your provider system or your provider agency would like to see from you. And we're fortunate enough to have the family standards as part of that. And part of that means that we believe that in Philadelphia, family inclusion, again, will lead to better care. And that means a better reputation for folks who are providing services within the Philadelphia area. But it also gives opportunities to other folks. So things like collaboration with family members. Providers really can benefit from that dialogue and that inclusion of family members. It's going to make services go a little bit easier if you have everybody on the same team and on board. Things like improved reimbursement. So in the state of Pennsylvania, we're looking towards an outcomes-based payment arrangement. We're moving away from fee-for-service. We're moving into more outcomes-based. So we believe that in those kinds of situations, providers could see improved reimbursements for the inclusion of family. And then of course, advocacy for funding. As we talked about last time, family members are fierce advocates. And they really can be in your corner. They can go to that legislator and say, we need more money in the budget. We need to make sure that my loved one gets the care and the services that they need. And we'll talk a little bit more about that later on in the standards. Next slide, please. And then of course, for the direct worker, family involvement can benefit you. So when you know your families, when you know the folks that you're working with, you're going to know when there's a crisis about to happen. You're going to know when something's not right. And when you know that, you can address it sooner. You can also have goals reinforced. If you're working towards supportive work or working towards independent living, if you're working towards some of these goals that individuals have in mind, it's always great to have somebody at home or in somebody's everyday life helping to support those goals and having those goals reinforced. And then, of course, that means less work overall for workers. We really do believe that the more you have everyone sort of at the table and involved, the less problems are going to arise as a part of that. Next slide, please. So basically, the family standards are just a guide for family inclusion, just some basic things that you can do to include families within your organization. We believe it's best practices for what you can do with family members. And we really believe that it promotes culture change. It's really going away from that individualistic, this is just the person that we're treating or providing services to what does that person's world really look like? How can we provide the system who supports and gives support to that individual who's also in treatment? Next slide, please. So one of the primary things that the standards contains is communication with families. So we're going to talk about a few things that can improve the communication with the families that we work with. Next slide, please. So one of the first things that we do in treatment and services is we fill out a lot of paperwork, right? We have somebody go through intake, we talk to them about what's going on, and then we have them pretty much sign, right? But one of those things that we tend to talk to people about is a release of information. And this is a pretty common process that we would do whenever we first encounter someone for treatment and services. Next slide, please. So one of the things that we encourage our providers to do is to think about how we approach the release of information, because we really can't establish a relationship with family members until we have that release of information. We have the permission from the person who's in treatment and services naturally of who they want involved in their care or who they may not want involved in their care. We encourage providers to have a discussion, just to talk about what's going on with the family, who is your support system, who are the people that you have involved in your life and every day. Sometimes those situations are good, or maybe things have soured if there was a crisis, but we just encourage the conversation so that you can get a better sense of what's going on with that situation. Then we encourage you to, or whomever is in the provider situation, to ask the person to sign a release of information to get that individual involved. If it's a good situation, if it's a good relationship, generally it's not a problem. It does become complicated sometimes. So what we encourage providers to think about is something like a family-friendly release of information, which means that the individual has the ability to say, yes, I'm okay with you talking to my brother, but I don't want you to talk to my brother about what medications I'm taking or what's going on in terms of my treatment plan, but you can talk to them about everything else. So giving the person some autonomy on what it is that they feel comfortable with without, cutting off the ability to have a communication and conversation with their supports. We also encourage that providers document what's going on so that it's apparent to the entire team of what's happening with that person's family situation or their support situation. And most importantly, if someone says no, that is 100% okay. You don't want to harass somebody into getting a release of information. But what we have found is that once somebody says no, a lot of times providers just say, okay, there's no family involved. We're encouraging people to really rethink that and to say, when is a good time to reintroduce the idea of getting a release of information signed? When is it a good time to reintroduce the idea of family? You have oftentimes opportunities whenever you may have recovery or goal planning sessions. We think that's an excellent time. Anytime you might be touching base, if something's going on within the family, or if they have something that they want to work on where they could use the support of their family, this is always a good time. So we really encourage providers to just keep trying to establish that relationship Even if it's challenging at the beginning, things may change. There's a chance that you can sort of help them work through some of that process so that you're not completely cutting the family out of the situation. Next slide. So I want to go to a little scenario and see if we can answer some questions about what we think we should do. So I'll give you a little vignette and then we can take a poll and see what we should do in this situation. So it's Candace's first day at her recovery program, and one of the things she does is meet with you. You go through some routine information and come upon some release forms. You know that it's important to get release forms for all kinds of places in order to give good services, and you explain to Candace, and she has no problem filling out the paperwork. Next, you talk about the supports she has in her life and ask Candace to fill out a release of information for her family or those she'd like included in recovery. Candace says sharply, "I have no family, and even if I did, they would be dead to me." She adamantly refuses to sign or talk about it. So what do you do? So, Patty, can you launch the first poll? So my question is, what do you guys think you should do in this situation? So how do you handle Candace's reaction to signing the release of information? A, leave it be. Candace is a grown woman. She knows what's best for her recovery. B, insist that she signs the paperwork for family, anyone, because you know family is important and she needs to get to that, and she needs to get that too. C, you know that Candace has family because she has an emergency contact, so you just call anyway. Or D, she seems pretty upset. Respect her wishes for now, but come back in a few days and try again. So it looks like we've got about 50% of the vote in. We'll give it just a few more moments. All right, just a couple of seconds more. Any more answers? Okay. Okay, so we can end the poll. So most of you said D, because she seems pretty upset. Respect her wishes for now, but come back in a few days and try again. Excellent, very good. Just to remember, when we're talking about A, leave it be. Yes, to some degree, we want to leave her be, but we want to make sure that we're coming back and we're trying. And just a reminder, just because she's somebody's emergency contact, she has an emergency contact, doesn't mean you should just call the family. You still want to make sure that you're getting the release of information. You don't want to be violating anybody's privacy. Okay, good job. Most of you guys answered D. That was correct. All right, next slide, please. So the next step of this is actually contact the family. So if you have a release of information, that means that you can move on to the next standard, which is contact the family. If you don't have a release of information, that's not something that you're going to be able to do. So just keep that in mind. Next slide, please. So what do we mean when we say contact the family? Really what we're talking about is you're starting to establish a relationship with that individual's family the best way that you can. So remember, if you have a limited release of information where you're not allowed to talk about certain things, that's okay. That's hands off. You know, don't talk about those things, but you can always listen. So just keep that in mind as you're talking with the family. You can always listen to information. So when you contact someone's family member, especially for the first time, you of course want to introduce yourself. You want to tell them who you are. You want to tell them what you do. They may not know, this may be their first interaction with somebody who's in the behavioral health world, or it may be something they're very familiar with. But you always want to make sure that you're introducing yourself, that you're explaining why you're calling, what the services is that you're offering, and to give them just a little bit of information on what it is that they can expect from you and from the team. This is also an excellent time to gather information about the individual that you're working with. So of course, the person that you work with in treatment and services, or maybe you've met through intake, they're certainly going to give you their history and things that they've been through. But family members frequently are there for all of it. And they're going to be a very rich place for you to be able to gather some good history and also give you some context maybe to what's going on with the person's situation. It's also a great time to solicit any questions or get any feedback from the family member. Sometimes you'll have family members who have been frustrated with how treatment has gone before, or might have some concerns. And that's a really great time to talk about that and talk about ways where you may not fall into those same patterns again, and open up a time for good communication. It's also a great time to provide that family member with things like resources. If you've been to the series previously, we talked a lot about NAMI, we've talked about support groups, we've talked about other things that we could be giving family members that helps get them what they need in order to be able to support their loved one. And then of course, in Philadelphia, we always recommend that folks document that when they've contacted the family, what that contact was about and what occurred during that call. Next slide, please. So next, let's talk about engaging families. So, we've got the release of information signed, we've had a chance to contact the family, but how do we really engage families? Next slide, please. So before we get started, let's take a quick poll. So true or false, providing basic and general information to family members about diagnosis, provider hours, or programs offered by a provider agency is a HIPAA violation. True or false? So Kathy, would you be able to launch that poll? No. Oh, there we go. So true or false? What do you guys think? All right. 28% of the vote is in. You guys are quick. All right. Excellent. Let's just give it just a second or two more. All right. Okay. So why don't we end the poll? Okay. So most of you said false. It is not a HIPAA violation. Correct. It's not a HIPAA violation to provide basic and general information. Remember, we're not talking about an individual or anything specific to what's going on with treatment or services. We're only talking about general. So for instance, if somebody calls you up and asks you, what is schizophrenia? I know my loved one is receiving services there, but what is schizophrenia? You don't have to confirm or deny that that person is receiving services, but you can provide them general information. You can send them to a website, or you can provide them with a pamphlet. But just keep in mind that just general information, families often need that, and it is okay, even if you don't have a release of information signed to provide that. Next slide, please. So this is standard 3. Offer ongoing support, guidance, and resources to all families. So if you don't get a release of information signed by a family member, that's okay. There are still things that you can do for that family. Should they reach out to you, should they contact you, you can still provide them with resources. You can still provide them with organizational information. Do they know what kind of services that your organization gives? Do they know what kind of hours that you have? So you're always able to provide that general information, and it is not a HIPAA violation. Next slide, thanks. So standard 4. Engaging participant in conversation about family members. So I think it's important to remember that regardless of what somebody's family situation is, be it supportive or less supportive, even if there's been trauma in the person's background, it's important to talk about family because it's going to tell you a lot about the person and where they are, not just in treatment and services, but also where they are with natural supports. Are they able to build natural supports? Families tells a story and it affects an individual's recovery. And it's really important that we understand that from a clinical standpoint so that we're able to help folks work through their recovery. It also gives us an indication of what kind of relationship skills does this individual have? Because at the end of the day, the goal is for them to leave your treatment and services and go live their lives in the community naturally with natural support. And if there are challenges with that, we want to make sure that people are working on those relationship skills, working on building those natural relationships. And that's really the focus for them in terms of relationships. So be it with a family member, be it with other natural supports, we want to make sure that we're understanding somebody's family, their family situation, and what kind of relationships they have within their lives. Next slide, please. All right, so poll number 3. So we're going to check back in with our friend Candace. She's still feeling resistant to talk about her relationship with her family. It's clear to you and the entire team that she's harboring a lot of anger and resentment to her about her current situation, and a good deal of that is directed towards her mother. When talking with Candace one-on-one, you ask how things are going, and she responds frequently with comments like, "It would be a lot better if everyone would get out of my business," or "I'm not a child. Why? It would be nice if everyone, when I went home, didn't treat me like one." So how would you respond in this situation? We can launch poll number 3. All right. So A, we want to avoid this topic. Obviously, Candace does not want to talk about her family, so it's best not to address the issue. B, tell Candace that it can't be all that bad and remind her that family is just there to help. C, tell Candace that family is a pain and she needs to not worry about them and focus on herself. Or D, ask Candace to talk about her concerns and discuss some of the benefits and challenges to her family's involvement. All right. So we've got about half of our respondents answering. People seem very decided on this one. Just give it a few more moments. Okay, I'm gonna end the poll. So actually all of you said D, ask Candace to talk about her concerns and discuss some of the benefits and challenges to her family's involvement. Great, that's exactly right. So again, remember, we want to make sure that we're hearing her, but we also want to make sure that we're opening up that opportunity to talk about what's going on. It might be a good thing, it might not be a good thing, but either or, we want to make sure that we're giving the folks we're working with space to talk about family. Next slide, please. So standard 5, engage family in recovery planning. So I worked in nursing home care for about 2.5 years, and I really enjoyed the aspect of family inclusion that happens within a nursing care setting. I think with older adults, we tend to include families a little bit more, and that makes sense for various reasons. However, it was really an excellent opportunity to feel as if I was giving my best services to residents and their family members, because I had everybody at the table. I had everyone participating. There was a meeting that we would have every 3 months where we would sort of go over treatment planning. We talk about what the process was. Were we preparing for discharge? What were we doing? And family members were always invited to that meeting. And I really loved that meeting, not just because I got a chance to, meet the family member, but also I got to see family members supporting their loved ones, and for them to be talking together and working problems out and, thinking together and strategizing on what would be a good next step. So it was really such a foreign thing to me whenever I worked in the nursing home, because I came out of the community mental health world, where when we did treatment plans or recovery plans, it was just me and that person, and we were just talking about, what was the next step. It was such a nice collaborative change when I worked in the nursing home to see that happen. And I really came away from that asking, why don't we do that more in the mental health world? Why wouldn't we want to have more family members involved, especially if folks are living with their family members or they're very close with their family members? So we think that engaging family members in these kind of planning sessions can be incredibly helpful if the person is willing to do it or would like their family member to attend. So we really encourage providers just to invite family members, as long as that's okay with the person who's in treatment and services. Invite them along, see if they want to come and be a part of that process. It's also an excellent opportunity to educate family members about their role in the process. You may have family members who are maybe over-involved or under-involved, or maybe just right, but it can give you an opportunity to talk about those sorts of things. I've met lots of family members who felt like they didn't have a role in their loved one's recovery, and a lot of that was because they just weren't included. So it was a very surprising thing to learn. Well, sure, your loved one's going through this, but this is how they could use your support, or this is how you could be beneficial in this process. And they really responded to that. So it's an excellent opportunity to, again, educate and help them feel like they're being part of the team. And then, of course, accommodation. So I always try to remind providers that family members don't work on a 9-to-5 schedule. They may not be available the times that our doors are open. So what can we do in order to accommodate family members? A lot of us have gotten up to date this past year by virtual connection. A lot of us now know what Zoom is or Hangouts are. And are we giving that opportunity to family members? And will we continue to do that once we're sort of all back working and seeing each other in person again. That can be very helpful for a family member who may only have 20 minutes on their break. So really thinking about what family members need in order to be accommodated so that they can be part of the discussion can be very, very helpful. Next slide, please. So now we're just going to talk about some organizational support things that we encourage provider agencies to do. This may not be something as a worker you specifically can do, but it's certainly something that you can think about in ways that you might be able to sort of use some of these techniques in the work that you're doing every day. Next slide, please. So we encourage providers to give training to their staff on family inclusion and supervision around it. So if you're not somebody representing a provider agency today, you may not have any say about how that happens or what happens in terms of training in your agency. But you can certainly share this training that you're going through today with your coworkers, or you can watch it again and you're here, which is a step in the right direction. So that shows a commitment to getting a training around family. But we believe that training will really help individuals working in provider agencies understand the importance of the role of family and that there is a role for family and the work that we do. We also hope that it will increase work with families. So provider agencies through training and supervision, they'll see that there is a need and increase the work that they're doing with family members and start creating opportunities for that. We also think that training helps improve comfort level with working with families. As I mentioned earlier, a lot of us haven't been trained to do this. A lot of us don't know what to do. We're not sure what's the right way to include a family member. But the more you talk about it and the more you work things through and the more you discuss it, the more comfortable you're going to become with exposing yourself to these situations where you're going to be working with family members and maybe feel a little bit more comfortable doing so. And then, of course, it's just another tool for you in terms of professional development. It's always good to learn something new and to be able to pull that in. Next slide, please. And then we encourage providers to formally monitor ongoing staff family inclusion practices. So for providers to check in and see how their staff is doing with including families. And there are definitely benefits to including family and sort of documenting that and making sure that that's written down and that you're expressing that to your coworkers as well. So first of all, when you include family and then you document it or you make sure that your provider agency knows about it, you'll get recognition for a job well done. And everybody wants that. In Philadelphia, because we're requiring it, that's why we're talking so much about documentation. But yes, folks there should get recognition for a job well done. It also shows provider agencies what kind of issues or questions are coming up and how they're getting resolved. It's a really good exercise for provider agencies to get a sense of what's going on in terms of family concerns and what might be going on. They may be seeing a trend there, something that they can address. So it's just very helpful to understand that. And of course, monitoring family members, you get the experience of what it is to interact with families, documenting that, better understanding what's going on with that. Next slide. So this is really a passion area for me in terms of advocacy for families. It's something that we've been working on in Philadelphia. Now that we've asked provider agencies to include family members and to hear their voices, we're now working on how to make sure that happens and how to get families a little bit more engaged and involved. Next slide. So let's have a quick discussion. So you guys can feel free to put this in the chat. I know I have just been chatting on and on and on, so I'm interested in hearing from you guys. So why do you think it might be important to collect feedback from family members directly? So if you can just put that in the chat page or the chat bar, I'm curious why it might be important to collect feedback from family members. Is it important to collect feedback from family members? Any thoughts? Okay, to get more context from the person, different viewpoints, sometimes give information. Right, exactly. They are experts. They have perspective and first-person experience that we may lack. Great. Yes, and to see if a transfer of learning is taking place. Very good. A lot of times families can give more information. Absolutely. So I'm curious, do any of you feel like it's important to learn about how families feel about the treatment and services that their loved one is getting? So what do they think? So not just about the information they're providing, but what kind of feedback do they have about your services? Is that important at all? Yes. To gain information about individual strengths, yep, and difficulty in the relationship. Good. So I'll ask this, what are some benefits of maybe checking in with family members to see how well services are going? If they are not invested, there are obstacles that need to be addressed. Excellent. Thank you very much. Their feedback is very important, right? Because we have to know how we're doing in order to make changes and make sure that things are going well and things are being addressed appropriately, improving the treatment plan. Great, great responses, guys. Next slide, please. So that brings us to standard 8, collect regular feedback from families. So we encourage providers to do a family survey, for instance, every year. What can you learn from your family members about how you're doing? So, we certainly encourage them to ask individuals who are in services how they're doing, but we also are curious from family members how they think providers are doing. So we ask them to do a 3-question survey. What are we doing right? What could we do better? What suggestions do you have? It can be that easy. And if you're somebody who's just sort of, working individually, one-on-one with individuals, you can always ask their family members, how are things going? What can I do to make the situation better? So it can be that simple. It doesn't have to be this big formalized situation, but feedback is so important. It also gives a chance for family members to talk about any questions they have or any concerns that they might have. I have a person that we've worked with, a family member who her brother was in an inpatient facility, and she was fearful to bring up some of the concerns that she had because she thought that her brother's services might be in danger if she talked about some of the concerns that she had. So she felt very reserved to bring anything up because she thought that her brother's treatment would be at risk. So that's a great example of, you may have family members that you're working with who are afraid to say anything because nobody's asked them and they haven't sort of been given the opportunity to say, tell us how we can improve services, tell us how we can do better. So it's not just an opportunity for a family member to sort of share that information. It's also an opportunity for you to address those concerns. And again, we always believe that addressing concerns sooner rather than later is the best way to go. And it also gives you an opportunity to get feedback on how you're doing. I know you're all doing the best that you can. I know you're all working very hard. And it's an opportunity to talk and get a little bit of feedback about what services you can be providing that could be helping that family and the individual. Next slide, please. And then this brings us to our final standard, which is standard 9. Recruit families to serve on boards, committees, and other advocacy groups. And again, having families share their experiences, share their wealth of knowledge, share their support with other family members can be such a powerful experience for family members who have been through this. Family members who have supported a loved one through the behavioral health system have so much to offer and so much to give. And when they're not in crisis, when they sort of come through the other side, many of them see themselves as wanting to give back, wanting to be able to support other family members, wanting to see how they can help the system and improve the system for the better of their loved one and other people's loved ones. So family members really are invested in helping other people, again, once they're sort of through the initial crises that they may be going through. They're also strong and powerful advocates. You're not going to meet a better advocate than a family member. A family member is going to fight to the dickens to make sure that their loved one has what they need. A lot of times we think about the behavioral health system, it doesn't have enough in terms of funding, it doesn't have enough in terms of resources. Who's going to go to the bat for you are going to be family members. And if family members feel like they have a place to do that, that's so important. family members who can be directed into areas of advocacy, or maybe you have advocacy that you're doing within your own provider agency, can really be strong and powerful advocates. They're the ones who can go to that local senator and say, here's my experience. It shouldn't be this way. We should have more resources for people like my son, or my best friend, or whomever it is that you're going to advocate for. Having family members can improve the culture, and having them involved in what's going on in the decision making within the agency can really change the way not only that family members are experiencing treatment and services, but also individuals. I like to give the example of, we had a rural group in Pennsylvania who they had an advisory group that they gathered together as part of a local provider agency. And they felt that the waiting room for their outpatient provider was very dreary and not very welcoming. So what did they do? They banded it together. They did a fundraiser. They got the resources that they needed together, and they improved the lobby of the provider agency. They put in more comfortable furniture. They painted the walls. They got a fish tank in there so people had something to look at while they were waiting for their appointment. So that's just a small example of how family members can band together in order to improve and spruce up the culture of what's going on in organizations. And then, of course, collaboration. Family members want to collaborate. They want to be there. They want to have a seat at the table. So we always encourage provider agencies to think about how they can bring more family members into the situation. An example of that is sort of in Philadelphia right now. We're talking a lot about our crisis system. And we have a group of folks who are both workers and family members, both from the adult side and the children's side. And everybody had been very upset about what's been sort of happening in terms of crisis, and we didn't have enough crisis resources. And because of the work that we've all been doing together this year, now that they're expanding some of our crisis teams, family members are going to be a part of that decision-making process. They took family member feedback when they were putting out the request for proposals of who is going to be filling in for those crisis teams and what those crisis teams were going to look like. So family members who may not have had the opportunity to influence what was going to happen with services were collaborating with our Department of Behavioral Health. And as a result, there's more family member influence, and hopefully that's going to make that process a more family-friendly experience. So just another example of how family members can be really great advocates. Next slide. So I'm curious, now that we've talked a lot about family, let's launch our poll. So does your agency have a family advisory board or a stakeholder committee? Okay, so we've got half. Interesting. Okay, so I'll end the poll there. So about 41% of you say yes, and about 59% of you say no. So it's very interesting. So it sounds like some of you are having some of those opportunities for family members to join up, and maybe some of you know, but that's, if you're ever have the opportunity to talk about what you can do to improve services, family member advisory board is a great thing to recommend. It can be very, very beneficial. So what are the benefits of having family members involved at a decision-making level? I can't remember if we put a poll up for that. Kati, if there's a poll, feel free to launch it. I did not make a poll for that. So why don't we go to the discussion board on that? So what are some of the benefits of having family members involved at the decision-making level? So at that, advisory board level, or perhaps at a board level. Do you guys have any thoughts? Ownership, accountability, and empowerment. Excellent. Absolutely. Real world input. Thanks, Dr. Zechner. Yeah, absolutely. So having ownership and accountability, that's a huge thing. And empowerment. Family members are going to make other people think differently about how services are run or how services are developed. True support and empathy, absolutely. And they're going to bring their story, and they're going to say, I remember when I was in that situation, this is what my family needed, and this is what was helpful for my family. and to really bring in that perspective. Empathy, absolutely. So, as workers, I think that we all tend to get caught up a little bit in sort of the day to day, and sometimes we don't stop to think and remember what it might be like for somebody who's supporting a loved one going through the process of a crisis or a process of treatment or services. So, absolutely. All right, next slide. All right, I'm going to turn it over to Dr. Zechner.
Thank you so much, Valerie. I just find it fascinating. I think these standards are really helpful and they're a wonderful place to start. And in fact, Valerie and I were talking about how might you do a little more in your agencies. And we started with at a practitioner or clinician level, what would you do? And you might consider using the standards as a guide for involving individual families. And I know that the poll indicated about half of you have a family advisory board, but there may be some other policies that or guidelines that you might consider. How could you include that? Also, to find some additional support or resources to create programming, or think about the kinds of services that your setting might require. If you're, a state hospital, what additional services might a family need? If you're an outpatient provider, if you're a peer support provider, what might families most need in those settings? Also, using external sources are helpful to just keep our saw sharpened, right? Like we want our clinical skills to be on top for our clients, but I think our family skills working with family also need to be very sharp because these are very complex situations. People may need a lot of support when they're in the community, and family can be a wonderful natural support to help people reintegrate into communities. So let's talk about implementation for a moment. I've been thinking more and more about implementation science, and there's this thing called implementation mapping, which sounds very fancy, but this is more organizational. And I realize that some of you may be at that level and some of you may not on the call, but that would be things like doing an assessment across the organization to learn more about what's needed or what stakeholders think, what families think, what people receiving care think, what other clinicians think. It may be things like identifying what kind of implementation strategies for family standards you might try out and what outcome might you want. Like if you're working with children, you may want to have an improved rate of family involvement in treatment, or if, you may want to have a greater contact with families. You just should think about what is the outcome that you're the desired outcome you have for implementing family standards, and figure out your champions. All of you are probably champions because you're here, but there may be some low-lying fruit as there low hanging. I'm sorry, no low frying, no low flying or frying fruit. We're gonna have low hanging fruit, and that would be the things that are easy to achieve, and those would be the programs that already have an element of family involvement, and maybe you want to expand it a little bit. And finding those people who are just natural engagers are wonderful. And using that family member input meaningfully. I mean, sometimes I know that organizations have family stakeholders meetings, but it's a little bit of a lip service. It's like a little bit like, here, let me give you a sandwich and a lunch, and maybe we can appease you. And instead, thinking about families as a wonderful partner who can really push the system and improve outcomes for your clients. And at the system level in New Jersey, we're so fortunate. We have a program called Intensive Family Support Services, and that is in every county in our state. We have a resource and support and referral service that is available free for families. And I don't think there's no time limit, and there's no cost for families. So that's a wonderful model. And if anyone wants more information, you can contact me privately, and I can send you. There's an article in American Journal of Psych Rehab about that model, which is interesting. Also, getting some buy-in from state, local, and policymakers and regulatory boards would be really helpful in terms of expanding out some of these services. I'm kind of curious, knowing what you know now about the standards that we reviewed, did any one of them stand out to you as something that you might want to go back to your agency and talk more about? Just put that in the chat if there was, one of the standards that really jumped out to you as something that you might want to consider in your organization. We'd love to hear about it. So go ahead and drop that in the chat if you have any ideas. In fact, that was the chat question. I just knew that might be the chat question. And it may take some processing and some time. This video will be available. The slides will be available. Kati will make sure that all of that is posted and sent to you, anyone who registered. But I encourage you to sort of think through that. And I know Valerie has said that they're in the process of redoing these standards and thinking about it from a children's standard perspective as well. Valerie, do you want to jump in on anything?
Yeah, absolutely. I think that we all came to this process just thinking about adults, thinking that the children's world had this figured out because legally they had to include families. And what we found was that the children's world also needed standards and that there are unique challenges to including families within the children's world. So we actually just completed a draft for the children's standards in Philadelphia, and we're hoping to launch that soon, which means that these standards will likely change as we look at how family inclusion impacts somebody across the lifespan. So really, it's not just a children's thing or adult thing. We really have to be thinking across the lifespan how families can be included in treatment and services.
That's a great point, Valerie. So, in summary, today we really talked about the family members and providers trying to work together using these standards as a guideline. And family involvement is really beneficial both for your organization, for the family members, and then also for your client outcomes. And these standards are a helpful guide. If anyone has questions about the family standards, could you just drop them in chat? Or you're welcome to reach out directly to Valerie or myself. We've got some resources here, including the NAMI and the National Family Technical Assistance Center and the Caregiver Alliance and MHA. And then we do, yes. Oh, there you go. So if there are any other questions, you might just drop them in chat. But in the meantime, thank you so much for all the work that you do. We're grateful that you're considering working more closely with families. And we encourage you to continue and use this valuable resource that is free and has a lot of energy. Valerie, do you want to add anything?
No, again, I just want to thank you for participating and attending today. And if you have questions about the standards or how you might want to implement that within your own system, please feel free to reach out. We're always happy to talk to folks about the standards. We really would love to see them widespread. So please let us know if we can help.
And thank you, Barb. Just put in there, there's a Federation of Families, great resource. Oh, I've never heard of that. Thank you so much, Barb. I will look into that. And I know that each state has some lovely and wonderful, unique resources, and every state is a little bit different, but it would be wonderful to have a more robust system of services for families of people with behavioral health conditions. Kati, do you want to say anything?
Sure. Thank you both so much for providing us with the wonderful webinar. And that concludes our family inclusion series. It's really been a very eye-opening series and looking at another perspective of family inclusion in our services. And also, I just want to remind all of our attendees, if you've joined us previously or if this is your first time joining us, all of the recordings of the webinars will be posted on our website. If you attended once in the past, you'll see that you also received a certificate of completion as well as a link to our slides deck that's also posted along with the recording. So that will be posted within 5 days, and you'll also receive a certificate of completion within 5 days. In the chat box, I also included the link to our evaluation survey. Please feel free to fill out and provide us with your anonymous and most honest comments that you have, so that way we can stay informed on how to better serve you as well. So we also can use the feedback. I just want to say thank you again, everyone, and I hope you enjoy the rest of your day and stay cool.